Okay, thank you everyone so much for being here today for this Department of Community Health Sciences and O'Brien Institute for Public Health seminar. I'm Kirsten Feist. I'm the director of the O'Brien Institute for Public Health, and really appreciate you all coming out here today for this, and those of you who are attending online. I'd like to start us off in a good way today by acknowledging that the lands that we're currently on are both the current and the traditional territories of the people of Treaty 7. And so this includes the Blackfoot Confederacy, which is comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bears Paw, and Goodstoney First Nations. And the city of Calgary and this land is also home to the Métis Nation within Alberta, Elbow, Métis District 6, and Nose Hill, Métis District 5. And so when I was thinking about the topic for today, planetary health, I was really thinking about how Indigenous ways of knowing and being and doing are really intricately connected with the land, and the health and the land of people are really synonymous. They're nurtured through relationships with the physical and social environment, and they provide a strong basis for health and overall well-being. And so, while Indigenous people have really resiliently weathered the continuous assaults on their sovereignty and rights through colonialism and its continued effects, it's been strained by increasing effects of global environmental change within Indigenous lands, including climate change and pollution and threats and impositions to their land and their water rights. And so I think planetary health really is an excellent topic to focus us and thinking about the connection between people and the land, and not necessarily an anthropomorphic or I guess anthrocentric way of thinking, and that the land and people and everything is connected. So with that, I'm very thrilled to introduce our two speakers for today. So Dr. Steve Wilton is a cardiologist and associate professor of cardiac sciences and community health sciences. He has a research program focused on the prevention and treatment of common high-impact cardiovascular diseases. Steve is passionate about research and advocacy on issues surrounding the health impacts of climate change and other environmental problems. He is the co-director for Planetary Health at the Cumming School of Medicine and the volunteer co-chair of the Canadian Association of Physicians for the Environment Alberta Regional Committee. And Dr. Sonja Wicklum is a family doctor and clinical associate professor in the Department of Family Medicine. She practiced rurally for 18 years and now practices in Calgary's Beltline. Her research and educational focus has been on obesity and diabetes prevention, community-based strategies to support Indigenous women's health, and more recently, planetary health. She is active locally and co-chairs the AFMC Planetary Health Working Group and volunteers internationally as the North American co-chair of the WONCA. I don't know what that stands for, World Organization.
It's actually Global Family Doctor.
Okay, Global Family Doctor Planetary Health Working Group, and she is the co-director along with Steve for Planetary Health at the Cumming School of Medicine. Really looking forward to your presentation today. Thank you for being here.
Thanks, Kirsten. We have a couple openers, and then I'm going to speak for a bit, and Steve's going to finish us off. Thanks for the introduction, and you're so right about the connections. We've got an elder who, when asked quickly on the spot, what would you say to somebody about planetary health? And just what came out of his mouth was, we have to act now, but we have to be able to act, and we do it for the sake of our grandchildren. And the concept of we have to be able to act, I think, is really important, especially some of you may be new to planetary health in the room. And I think it's tough work to do because it's a worry that sits in one side of our brain. And so acknowledging that you may not always yourselves have the capacity to be able to do that work. So again, that holistic view of the emotional, the spiritual side of us, which comes from Indigenous peoples, is so important to remind ourselves as we walk through this journey. So just a quick opening slide of where things sort of started for me. So I had been in Calgary a year when the flood happened, and I got a call on day 4 saying, "Do you have some gumboots and a bike? Because we forgot a building in the East Village." So my 2 kids that were in high school at the time, and my husband and I rode 4 across down Ninth Avenue, very eerie, on day 4 of the flood, and us plus a couple of nursing students, a couple of actual nurses, and the occasional exhausted firefighter evacuated 17 stories. And it just sort of grounded you. And it was a building where a lot of people had challenges, whether mental health and certainly socioeconomic. And so it was a bit of an eye opener. And then it was the smoke events that really drew family medicine into this planetary health picture.
Yeah, so a similar and slightly different journey for me into this role. So, as you heard in my intro, I'm a cardiologist. I did a lot of my training in epidemiology, clinical trials, sort of hardcore clinical research, and was not an environmentalist at all growing up or even recently. Sort of been climate concerned, tried to ride my bike and have solar panels in my house for a long time. But what really did it for me was when sort of 2017, 2018, when we started to have really bad summers with smoke in Calgary and elsewhere. And, I remember one particular morning just getting ready, going for work, and went outside, and the sun was this sort of like dark red ball, and there was this nasty sort of cold wind blowing ash across my, across my yard. And I just thought, oh my gosh, this is horrible. This is gonna, like, my kids who were younger at the time are gonna think this is kind of how summer is now. And I know that it wasn't always like that. And so I decided I needed to try to do some things. And the first thing was just learning some stuff about all the interconnections. I actually hadn't thought about climate and health together at that point, honestly. It was sort of like climate change here and the health work is here. And so it was sort of, I had some good mentorship from friends and neighbors who'd been doing advocacy for a long time, and sort of got involved in that vein in terms of volunteer work and advocacy in the communities. Just there talking to MPs and having booths at the Lilac Fest and attending protests and things like that were kind of fun. And it's really just over the last short while where there's been a professional opportunity to actually bring some of this stuff to my day job. So that's really exciting. So that's why I got here.
So it's a lot of ground to cover. And right now, when Steve and I are talking to audiences, there's a degree of leveling up that we have to do. So hopefully in the question period afterwards, if there's key things we haven't answered, by all means, hit us with them, because some of you are experts in the room on this topic, and some of you might be quite new to you. So we're going to try to cover the understanding inseparable relationships between environmental human health, importance of transition to more sustainable healthcare, and our school's role. So planetary health, definition-wise, it was 2015 that it was coined, so very late. The first Paris Agreement about climate change was back in the mid-90s, so very late that healthcare came to the table, and this was the Rockefeller Foundation and the Lancet that coined it. And so it is the definition there. I'll let you sort of read, but One Health, same concept. So it's all living creatures and that interdependence. And I think global health, obviously extremely relevant in public health, a massive pillar of what we talk about in planetary health. So there's some squabbling that goes on about which definition is better, but here with the One Health Institute, we're trying to collaborate quite closely. So we're in an interesting time where, what you folks do in the room, you're well aware of this fact that by and large, humanity's flourishing. So we're living longer, we're having much lower childhood mortality. So things basically have markedly improved over the last quite a few decades. But sadly, it's a bit of an ecological paradox right now because we've tapped the Earth's resources so much so that things are starting to tip, where the ecological health, everything that supports what we want to be able to do, is now being threatened, which is threatening our health, as we're seeing with what's happening with the impacts of climate change. So if you look at work being done around planetary boundaries, and this is Rockstrom is the name of the first author that has led a bunch of this work. But they are stating that we're in a critical time period. It's flashing red. Basically, 7 of 9 planetary boundaries are reached. And it's important to go beyond just climate change, because you see on this diagram, so climate change is 1 of the 9. And so climate change is the greenhouse gases going into the environment causing the warming. Excuse me, but biosphere integrity, so biodiversity, is falling off at a super rapid pace. Land system change, things like the fact of deforestation is going on, has also broken the inner circle. The green area is the safe operating system. If we look at fresh water, those are big concerns for us here. Droughts, the use of fresh water, biogeochemical flows is kind of the overuse of pesticides. Compounds into the environment. That's telling me probably to speed up. You didn't see it, but slide on forward. Ocean acidification is the one that they feel we just breached most recently. And that's literally where the acid of the ocean is dropping. And hence things like the lowest elements of the food chain, like the shells of snails, are being harmed. They're not forming properly. You can imagine what happens if the lowest level of the food chain collapses to all the levels that go above it. The good news on that slide, can anybody state one of those ones in the green that we actually, where the world got together and it made a difference and improved things? You're saying, did I hear you say ozone? Yeah, you're right. Yeah. So the Montreal Protocol, the world came together and actually made a difference. So the hopeful part of this is they're coming together at COPs, and can we make a difference and change and redirect these other areas? And I just put this slide up, just, this is a donut economic sort of model, which many of you may have heard about, but it's basically using those boundaries, but we need and we want to provide our people, society with all those basics in the green: the political voice, peace and justice, food, water, health. But it's figuring out how to live and do those things within that boundary that needs to happen. And it gets challenged by things like Trump coming into power and switching and making every place very concerned about the economics that are going on. So I would say prior, despite it being his second time in power, certainly since he came in this time, we've seen some of the biggest impacts where countries are scrambling to protect themselves in various ways, and they can't focus on the commitments that they did or that they made during the Paris Agreement. And then this is just really nice work by Courtney Howard, who lives up in the Northwest Territories and has led a lot of this work. And for those of you unfamiliar, it just talks about these ecological determinants of health. And when we think of an individual's health, it's really, healthcare, the work of Steve and I, family med, cardiology, we think we're having this big impact, but we're about 18-20% of the impact. The next are their structural determinants of health. And then the biggest one is actually the environment around them that is their health. But here just gives a nice diagram, if you walk through the levels, how these changes on the bottom level impact our infrastructure. That can impact our staff, from a risk to staff to help them come in, damage to the health infrastructure. If you remember, hailstorms, not last fall, but the fall before, took out a wing of the airport. What if it takes out the new cancer institute? What do we do, and how that will impact things? Sorry, I've got to speed up. The health, and then the health impacts are along the top. And this is just a list of some of them. And arguably that conflict and migration on the right and malnutrition on the right, we feel them less as Canadians, but I really want to highlight them here because the predicted number of climate migrants is off the charts. And as you know, countries are starting to recoil in how many people they take in or accept, but we have to realize that many countries are having to evacuate where they are. So it's going to be a very big factor in the future. So this is from the Lancet report for Canada. So the Lancet does an annual report for the globe, highlighting what countries are doing and what impacts they should be focused on. And we just want to bring it to your attention. There's a lot of words here, so I'll go next, actually. I'll just hone in on these. So the big elements for Canada are our heat extremes. So as we all know, we've had heat domes. 619 people died in Vancouver during their heat dome a couple of years ago. And it was really highlighted there that it was vulnerable individuals indoors that were most impacted. And we've seen heat domes elsewhere. And the center one is focused around air pollution, and the last one around wildfires and droughts. And there's more in a second. The other thing that this year's countdown for Canada in 2025 emphasizes is nutrition. Last year's emphasized that healthcare institutions should play a role in leading sort of a circular economy around nutrition, cleaning up what we do in our hospitals to try to lead by example. And so some hospitals have made some great progress. For example, in Quebec, they've lowered their footprint significantly by switching some of their red meats to legumes, and they've made it much more circular. And so certainly something that we could be looking at in Alberta. So, and we'll touch on these in a moment. This slide is from the IPCC, so the Intergovernmental Panel on Climate Change, 195 countries, top scientists. We have representatives from Canada. They get together, produce a report. Their last one is the AR6. It was done in 2023. And I just highlight this because those of us that practice, we know we really appreciate clinical practice guidelines, and we know that we hope that they're done with a degree of rigor. So I highlight the red circle corner here around these. The AR6 reports speak the same language that we do. And they highlighted under health and well-being, infectious diseases, heat, malnutrition, and harm to wildlife, mental health, and displacement as the top elements. And swinging back to the Lancet report, so the key elements for the global report were drought, changes to nutrition and food production, wildfire smoke, air pollution, influencing things around the world, and heat. And we'll just take a second. If I showed you a heat map of Canada, you'd see that the north is warming a lot faster than anywhere else. So really important for us to recognize that already ways of hunting, traveling have been impacted. And as you're all aware, I think the stats were, I have it on a different slide, but the evacuations last year from territorial people in the Northwest was super high, like maybe 60% were evacuated at one point, 60 to 70%. So their impact much higher than what we're having here. Great example of what they were feeling in Fort McMurray a few years ago. And then just a couple of notes, reminders for us to talk about that climate impact somewhere else in the world, like Puerto Rico on the right-hand side was the key supplier of IV bags. And so all these events that have happened over the last few years with horrific climate events made us realize we have to have more robust systems and supply chains to look after things. So switching gears so Canada, where do our greenhouse gases come from? So 2024 data, oil and gas, 31%. And that's just the production of oil and gas. And obviously, most of it's done here in Alberta. Next up would be transportation, heavy industry, buildings, ag, electricity. And if we look at the big box on the right, healthcare isn't a sector, so it doesn't get reported for Canada on that last slide I showed you. But if it were a sector, it's responsible for about 5% of global greenhouse gas emissions. And that is true in Canada. So it's real what we produce and how we contribute. And AHS has actually done some nice data, and you see that most of this is coming from the supply chain. certain percentage from heat, electricity, and in the other category, that flows out into anesthetic gases, transportation, fuels, waste and garbage, paper, and business travel. And so looking at this helps us, and especially when you're looking at public health and big, higher orders of operations, where should we put our effort if we're going to try to mitigate things? Because we have to be very careful. Right now, in a lot of the action that's happening, it's beautiful, and we've had to push levers to try to get it going, but sometimes it can set up some false dichotomies. So for example, in the anesthetic area, we know desflurane is a horrific gas. It's high greenhouse gas impact. So there's been a big push across the country to decrease its use, and everybody signed on easily. So to focus on that has been really good to raise awareness. It's been an easy thing to do. I'm not an anesthetist, but by and large, I think there's very few circumstances where you can argue for this drug to be used. But you have to just be careful, because the absolute impact of changing it isn't necessarily as big. We've got a lot bigger heavy hitters that could do it, but it is important that we kind of have gateway actions that we can use to engage people. So very important when we're thinking about everything we do now, when we talk about supply chain, when we talk about any action, your research project, how are you carrying it out? A QI project for a family medicine resident. Are you actually printing paper in what you're doing? We have to think of every product that gets used. We want to be thinking about life cycle analyses. So what it takes from raw material extraction to processing to manufacturing, assembly, end of life, and disposal. So when I talk to, for example, a resident about, they want to perhaps use a sleep medication because the patient loved it. It was started in the hospital by those nasty hospital people. No, and they loved it. They want it again. And there's all kinds of reasons to not start them. But the one that we add in now is saying, but also, if the patient really loves it, stays on it long term, you have to make the drug, package the drug, ship the drug, and dispose of the drug afterwards. So we have to just expand our thinking now in all the way along through our cycle of care. So this is a really nice way to anchor thinking about what we can do with respect to sustainable healthcare by Mortimer's group and the Centre for Sustainable Healthcare in the UK. So these pillars, the order of them matters. So number one, and the most important one, is prevention. So this is where you guys come in. Public health, family docs, we do a lot of it too, but public health, heavy influence there. And obviously, if we're keeping people out of the carbon intense facilities and off of the carbon intense medications, we're doing a better job. The second one is patient self-care. So again, public health, huge role in this. Schools, huge role. Primary care, huge role in this. So if patients can take care of themselves better, that they don't access care as often. Lean service delivery. So when people need to access care, that they can access appropriate care. Maybe it's just a phone call, maybe it's a visit with the right level of the person. Our office is piloting that our MOAs now will handle all of our follow-ups for hypertension. And they're super excited about it. And it's an easy thing they can be doing, but it's novel thinking. It's crazy that we didn't think of it earlier, but that lean service is so important. And obviously at systems level, it makes a whopping difference, as we all know, of the severe ER crisis going on right now. And lots of our patients are orphaned. And then the fourth one, when we do need to do something and we need to care for people, we need to look at the lowest carbon alternatives for this. And I just want to highlight for this crowd, I didn't have a chance to review it in detail, but the UK just this week produced a document stating that they're going to look intensely at AI and its use in their healthcare system. And they really think the prevention end, the patient self-care end, it will hopefully save a lot. And we may talk about AI later because there's conflicts there, but I just want to flag that document's out if people want to search it and find it. And then that framework of Mortimer, so Andrea McNeil from Vancouver has done some nice work framing it in a Canadian document. So I just wanted to highlight but it's the same sorts of concepts as that more large document. And then lastly, just highlighting the elephant in the room for primary care. Pharmaceutical production, 48%, but metered dose inhalers, for example, they take up 13%. So that, if we look at that, say compared to desflurate, that is a massive footprint. So that's a nice, it's also an easy one for primary care to do. So one of our projects with Estes is we're reaching out to docs to really ensure education's increasing about metered dose inhalers. And just people in the room grounded, a metered dose inhaler has a propellant in it that sprays the drug into your body. And it's that propellant that's really bad for the environment. So basically 10 puffs is like driving 9 miles in a car. Whereas dry powder inhalers can deliver the medication just as well and have markedly lower footprint. And so my last slide, and then I'll hand it to you, Steve, is just talking about this practice guidelines. The groups of GRADE and the Cochrane, I don't know if anybody in the room is involved in either of these, but there are now planetary health working groups for both. And they're really trying to frame how can we put planetary health into the decision. So to avoid false dichotomies, like if you even look at the mass thing. So I didn't get a chance to review this work, but Thomas Piggott, a fellow from McMaster's, was discussing how if we look at masks by themselves, we know they help reduce COVID-19's impacts. But when you take into the environmental impact of them, if masks are not managed well, it may become more challenging. So they are trying, it may become more challenging to be convinced. So anyways, I think we can all learn when we're trying to develop, say, a way for our research departments to look at this, or a way for us to look at things, to look at some of the work that they've done to try to think about how you incorporate planetary health into your logic models when you're trying to make changes.
Thanks, Sonja. So now it falls to me just to tell you a little bit about what we've been doing and what our objectives are over the next little while with our Planetary Health Hub. So hopefully, Sonja has already convinced you that there is a role for medical schools and academics within medical schools to get involved in environmental issues. But not everyone understands this, so I'll just give you the 3 main arguments that I have, and they are that, medical schools really sit at the junction, the nexus between science, medical science, healthcare, and communities. We interact with all of these groups, and we have the ability to actually be a translator sometimes in these groups. People believe us. They believe doctors they believe nurses a lot in terms of when we have an important message, they will listen. Even politicians sometimes will listen to us. So and academics as well, right? So we have an ability to communicate and to deliver messages that are important into places that need to hear them. And then just as practitioners, if you're a doctor and you took an oath to protect health, if you are an academic, we know that if we're working in public health, it's kind of our moral responsibility to be involved and not to look away from these problems. So for these reasons and all the great evidence that Sonja has provided, we think it's a really important activity at our medical school and at all medical schools. And actually interesting, and maybe not surprisingly, before we all got involved in this, the medical students were at the forefront of pushing people to do this. So this is the Canadian Federation of Medical Students, and there are groups as well in other academic disciplines who actually put together the first kind of recommendations and guidelines around, hey, we want to learn about this. It's not taught in our medical school curriculum. Please, guys, tell us what we need to know. And they actually put together a really good list of competencies that now are being attempted to put into curricula in different places. And one of the things that came out of that belatedly was actually the AFMC, where Sonja is the co-chair of the Planetary Health Committee in 2023, actually put out a really very direct call, a declaration on planetary health. And you can read the text there, but essentially in calling it a code red emergency and calling for all medical schools in Canada to immediately implement various changes in education, research, and transition to a climate resilient and low carbon health system. And actually, the very next year, put together a more detailed roadmap of what that would include. And right at the very top of the list of actions that a medical school should take is actually to have named positions for people working in this field. And that's how Sonja and I got our jobs. So the CSM has signed on to this declaration, and Todd and then Kanino Setutu, the senior associate team for HEST, put together a position, and we both applied and for one position, and we both got it. So it's really a joy over the last year to work this out. And it does feel like and sometimes drinking out of a fire hose, because there's a lot of stuff that we'd like to do. So here on the slide are the traditional activities that happen at all medical schools, I think, right? So we've got education of different forms of learners. We're involved, of course, in delivering care to people. We participate and lead research, and we also have a responsibility in our communities to model good behavior, to tell people what we're doing and get people interested so that they will support our medical school. And really, there are rules for a planetary health action in all of these. So if we think about the areas where thinking as a climate advocate, there's three main areas. And if you haven't heard these terms, I'll just go through them. So mitigation when it comes to climate change is things that we can do to reduce the pollution going into the world. So yeah, you can think of lots of examples of that. Adaptation, sometimes also called resilience, is recognizing now that there are going to be some changes regardless of what we do, and how can we make sure that humanity can survive and hopefully flourish despite all of these changes. And then of course there's role for advocacy and interacting with both of these areas, because things don't tend to necessarily change spontaneously for the better. So if we focus now on the first part, education, this is a really nice diagram from what's called the Planetary Health Education Framework. It's something that I would recommend if you're interested at all in education and curricula and pedagogy. It's worth a read. It's not a long document, but it challenges us as educators to really take not even a step back, like a bunch of steps back from what we're doing, and not think about simply adding in a little case, study inside a course that's related to climate change or anything like that, which is important. And that's, those are the things that are included in the medical students wish list. But actually just step back and think, if we really want to aim for holistic changes in the learners and health professional learners, what are the things that we want them to be confident and have an appreciation of? And at the very center of the diagram is this interconnection with nature. So recognizing that even though we live in a big shiny city, we're actually just animals, and that we're interacting with the environment and we're dependent on the environment, and everything else kind of flows from that. So the Anthropocene and health is one other important area, and that's just recognizing that, yeah, our modern society and all of the things we've got comes with costs to the ecosystem, and those costs are now starting to come back and bite us in the butt in many cases. It also talks, I think this is really important and something we do poorly in clinical care and education is systems thinking, right? So Sonja mentioned life cycle analysis, and you could do that for any little decision you make out there in the world. If you went and did a life cycle analysis on it, you would probably freak yourself out. But I think when it comes to really big decisions in how to, at a policy level, having a systems thinking approach, meaning looking at the second and third order effects of the decisions that we're making and what might happen in the future, is really, really important. And then all of this is sort of grounded in equity and social justice. So it's a lot to take in, and sometimes it's much easier to put in little fixes, little bits of curriculum to feel like we're doing something. But I think in the long run, this is kind of the direction we'd like to go. And of course, just as a reminder to all of us in our medical school, we have a bunch of different learner types. So we have our medical students, the undergraduate medical education. We've got a bunch of grad students in different programs and a very robust program in community health sciences. We've got all of our residents and fellows. And of course, we've got our faculty who are already here and can still have a few things to learn about this, probably more than students in some cases. So what have we been doing to operationalize things? So in education, like good academics, we of course struck a committee. And it's actually of the committees I'm on, it's actually kind of a fun one and a good one. And we've got really broad representation from students and then from some of the leadership of the different learner or educational program types. We've got support from Esther Tailfeathers from the Indigenous Health Office. And we've had just a couple of meetings so far, and really at the start, we're really just trying to figure out where some of these topics already exist. So as you probably know, the undergraduate medical education curriculum just underwent a massive sort of reorg over the last couple of years, and they've actually put in a number of interesting cases and things, and it's a lot better than it was in terms of planetary health stuff. But we think there's still some potential opportunities in residency programs. The family medicine residency is really, really far ahead of any of the specialties in terms of incorporating this. So that's thanks to Sonja and her colleague Clark Spurchek primarily. But there are some people interested in different programs within postgraduate med ed. We have given a talk to all the surgical residents about this, and there's lots of interest, psychiatry, everything. So, and there's actually a position now within the PGME office to sort of coordinate all, do some shared learning, develop some shared modules and things. So that's just starting. And so the overall goal of this, right, is thinking very far ahead. Systems thinking is the next generation of learners and health professionals is going to have this in their DNA, essentially, and it's going to be thinking this way as they go forward. As well, the teachers are hopefully going to have this incorporated into their the other thing we've done on the education side, again, led by students, is participated in this initiative called the Planetary Health Report Card. So this is a global initiative that started in the US about 6 or 7 years ago, and essentially tasks students at different health professions to do an evaluation of what it's like at their school in terms of these 5 domains. So related to curriculum, related to research, related to community outreach, related to ability for students to actually participate in initiatives, and actually the sustainability on campus. And so there's a very detailed form that they've put together, and Sonja and I have kind of overseen, and we've now done it twice. We actually have data, and our grade went from a C+ to a D- this year, so we're kind of happy about that. There is a little bit of progress, as you can see. Some of it is actually just recognizing, having better information about the stuff that was already in the curriculum that we didn't hear about the first time, and just more activities like this. So that's really good. We're going to keep doing that and hopefully get to a higher grade pretty soon. Next pillar is research, and I've changed this to research and innovation because I think there's, we have to go beyond just pure research and looking at this stuff. And again, the first thing we've done is try to do a bit of level setting. We're using a methodology called asset mapping to really look across the whole University of Calgary community to identify labs and investigators and teachers who are working in planetary health or related fields. And we've done this over the last few months. We ended up getting 40 respondents from all across the campus, a lot from CSM, but a ton from veterinary medicine, science, arts, education, and even business. And it was really cool because most of them who responded were actually currently or planning to work on this kind of stuff, which is great. And we've now got a really nice list of people and the topics they're interested in that we're going to put together into a nice report and put on our website pretty soon. Tons of different themes covered. And there was we asked people to talk about the barriers and the challenges they've had in that survey. And there were some common ones, like all academics, they're worried about funding, data availability, collaborators, and then some specific challenges around these types of planetary health projects not being super easily understood in most granting agencies, and the challenges of really doing transdisciplinary research. It's even hard to say that, so it's really hard to do it.
Just syllables.
Yeah. So that's been a really interesting project, and I look forward to sort of finalizing the report on that very soon. We think that there's a ton of momentum and great opportunities here at our medical school to do this. We've got lots of great people, we've got amazing talent, and we've got wonderful infrastructure for doing different sorts of planetary health projects. So for those of you not familiar with all these different acronyms and logos, so I know you know the one in the middle there, the O'Brien Institute is clearly a leader here. The Center for Health Informatics is really, I think, a nation-leading data center that can really allow us to catalyze very, very unique, complex analyses of environmental and public health data. And I've just recently put in a large grant using their services to hopefully look at the environmental impacts and health impacts of the fossil fuel infrastructure that we have here. The one on the bottom left is the One Health Initiative. That's their new logo, and they are small but mighty, I would say, and really interested in collaborating with us. Of course, Department of Community Health Sciences, and then the W21C, which has been around for a long time. When I was actually around when it was started, and it was really called the Ward of the 21st Century, and that was, now it's not silly, right? Because words are in the 21st century, so this is the acronym. But so they have obviously a lot of brilliant people, a lot of great grants, and a lot of ability to test some novel innovations that might help with mitigating certainly carbon or climate impacts of things we use in the hospitals. We've got a great lab doing that. And then our own lab group, which I'll talk about in a moment. Right there. So yeah, so that Health Equity Systems Transformation portfolio is that one I mentioned earlier. That's Dr. Osei Tutu's overall portfolio, and it includes a bunch of different activities. And so there's the Office of Faculty Development, there's the PESJO, or Precision Equity and Social Justice Office, and there's our hub, the Planetary Health Hub. And when we joined, we actually got together and decided to form a little research group that was really marrying all of these different types of activities. I would say research and innovation groups with really a goal to improve health by advancing health equity and improving planetary health. So really recognizing the fundamental links between planetary health and health equity. And we have this very innovative, flat, collaborative structure. We've done a lot of, I guess, value setting and prioritization and strategy, and we've now started to put in grants for a number of different projects that are, using technology to try to tackle either health equity or planetary health issues or both. And so, yeah, more to come on that. It's been really exciting, and I think only will bring good things. And then the last pillar is around community outreach. This is where I think we've done some things. We're doing events like this. We participated in Leadership Forum, which was a great opportunity back in the fall, where we got to speak to the dean and all the associate and assistant deans and department heads and institute directors to tell them about this vision that we have and hopefully get people excited. We started to work with different policy groups and looking for ways to more actively engage with into quality matrices. We've got some KPIs for our own activities, of course. And then we recognize a need to further expand our visibility and engagement with the broader community. So there's a lot of people in Calgary and Southern Alberta who are really interested in these topics, and not all of them are at the University of Calgary. So we've made initial, contact with people at the city, with this group called Action Dignity, my own group, CAPE, the Calgary Climate Hub, and there are many others. So hopefully in the fall, we will all get together at our upcoming Planetary Health Launch Day, which we've decided to defer from this spring, just because all the students were going to be away to do it. So that's what is coming up next in our community engagement stuff. So last part is, so what are the big challenges that we're facing? And what are the questions that we must answer? And part of this is we're going to be asking you guys about what you think. But one big challenge is that, that's a little animation here. Environmental issues, climate issues have, never been probably the top issue in most people in the broad community. I always feel like it's been the second or third most important issue a lot of the time, and that is maybe not enough for really having real change happen. So this is a poll from 2023. It'd be really interesting to do it again now and see how things have changed. But High quality healthcare was the #1 overall issue. People care about affordability, pocketbook issues for sure, education being prioritized. And then there's a lot of passion in our province, and we've seen this with political action, political events recently around maybe not talking about climate change, but actually, hey, protect my beautiful scenery and protect the environment that I love that way. And that is actually an issue that transcends political affiliation most of the time. So stuff around, let's say, preventing coal exploration from going in eastern slopes is something that maybe 80% of Albertans would support, and there's not many issues that are like that. But on the other hand, this doesn't allow our planetary health work to really reach the top. And I think if we did a poll that was similar to this, but focused on, let's say, the medical school community, you would find similar things. Like people are concerned, but they're also concerned about the budget cuts, their waiting list in their clinic, the ability to, get their grad student through their exams. And so how do we get people to really put aside those things that are red alert issues for them and actually think about this stuff? And we don't have great solutions for all of that. We also have challenges in the broader, information environment out there. So there's only really 2 topics on the news right now. It's either Trump or AI or both. And so getting into people's minds about this and actually getting accurate information to people when they need to see it has been really hard. We've got trouble with people's attention, being able to pay attention to the same thing for long enough to do anything about it is really hard. And then the map in the center I just put up because it's kind of the giant elephant in the room. So to those little dots is a oil or gas facility in Alberta, and clearly it's a major industry in our province. And there's the old quotation that it's hard to get people to believe something if their paycheck depends on them not believing it, right? So we have an issue that I think we will address head on, but we have to work with the fact that we live in Calgary, Alberta, where our medical school has everything that has a name on it is named after somebody who works and has made money in the oil industry. So we have to live with that. So actually, we'll stop there. We're kind of at the end of the time. So thank you very much for your attention and look forward to 3 questions.
Thank you both so much, Steve and Sonja, for an excellent presentation and really thought-provoking and exciting. So love to open it up to those of you who are here in the room and online for any questions or thoughts. I can get things started. What is the biggest opportunity or that CSM can do? Like, what would be the highest thing on your list to say to senior leadership that we should be doing here to help move the dial on this?
I can start. We might not have the same opinion. So yeah. I'm a researcher primarily, and I would say actually the education aspect is the most important part. I think that we're in this for a long game, and I think if we want to really make change, we need to make sure our learners and our teachers are kind of teaching the right stuff. So that yeah, we can do lots of research. I love research, but I think we want to do only one thing. I think I don't know what's on.
Yeah, educating everyone. It sounds like
everyone we can reach, right? Yeah.
Okay, we'll open it up to the room. Anyone here? Yeah, sure.
By definition, the things you're trying to affect are how do you measure the impact of the efforts that either obviously the activities that you're trying to organize? Like, that's a challenge.
It is a challenge. So I think things like the Planetary Health Report Card helps when we look at education. And then we're going to try to track our penetration of things that aren't, in the Planetary Health Report Card, like as far as we've had the meeting with senior leaders, and then we hope to have sessions and modules available for, sort of that next level of leader, and then working from the bottom via the students asking, and demanding change and questioning what their preceptors are doing, and also from the top that way. But it is challenging to track, so that is one tool. And our community engagement, I think our, again, tracking wise, our events and our days are clearly just ways that you track it. And then our projects will always try to keep a pillar in each one of them, be mindful of, are we actively thinking? And we also don't want to, one of the pillars of planetary health, we didn't go into it deep, but it is understanding how Indigenous peoples have dealt with things. And that's actually very challenging because people know in this room, our Indigenous professors, etc., they're tapped. They have a lot on their plate, but we need to be very mindful that we're doing that too. So if that helps with the question.
We do have a question online. So Inelda is asking, do you have thoughts on whether the quintuple aim should be updated either by reframing population health as planetary health or by expanding to a sextuple aim that explicitly includes planetary health alongside quality care, population health, provider well-being, equity, and cost control?
I can try. I mean, I would say yes and no. Like, it's always nice to have recognition, but I think one of the things that's become very clear to me is that if we achieve the quintuple aim that we have already, you know, giving good medical care is actually good planetary health care. So focusing on prevention, doing appropriate things and not inappropriate things, doing efficient care. So I actually don't think we need to have that, but what do you think?
So the question again becomes, do you need it as a pillar, kind of like I talked about the grade recommendations? Do you need it as a pillar so that you're reminded to think about it? But I agree with your comment. It should be like we're arguing for it to be embedded in all steps, the research that grounds what we do to the first meet with the patient or what goes next. So, but it might be a way of communicating it. We know the authors of some of the authors of that. There's a nice paper written about the argument for the sextuple aim, and it makes sense, but you do have to be careful that it's not an add-on. Wording kind of language matters. In some spheres, sometimes we even hear it classified under non-medical, which is non-clinical, and so we have to be careful that to raise awareness, we don't distract from what Steve brought up. Needs to be embedded.
Thank you.
Yeah, please go ahead.
Within the University of Calgary, I wonder what are your efforts to lobby for introducing more education for undergrads and grads and residents at a required level? So I wonder whether your work has contributed to some courses being now part of education, while we understand that curriculum is quite loaded and we kind of medical students. I wonder how your efforts align with whatever administration at the Cumming School of Medicine thinks about the current situation, and what is your plan, like the roadmap, or making some of those courses on planetary health required rather than just something optional just to even take or not?
Well, sure. Well, I can take this on. I think our planetary health curriculum committee. So of course we do things because of accreditation of med schools like that. Done at the AFMC level to have planetary health put into accreditation standards. It is part of the LMCC exam. It is part of the Royal College exams. It is part of the College of Family Medicine exams. And we are not getting any pushback, thankfully, I would say, on the curriculum committee. We just know it just takes time to build things. It takes time, like Rhyme just created this whole beast almost before we rose into place. So for Rhyme, that's asking them to go back in, re-exam it, which they're willing to do, but it just takes a bit of time. So I would say the response has been super favorable. And already some of the things we do related to having students in community practices do help with some of that.
So there's a few things that are mandatory. a lot of things mandatory, but there are, so like in the family medicine residency, right, they have this mandatory thing that they do. Talking to the surgical residents, they all have to do a QI project as part of their residency, quality improvement project, and they're now being encouraged to use the sustainable quality improvement, which we didn't really get into a lot, as some of the project ideas same in family medicine. It is, all of the different curricula are pretty packed. But so yeah, we will hopefully use a lot of carrots and not too many sticks to pull them along. And I guess the only other thing for education is, we haven't really gone to bug Tolu yet about, when would be a good time to have a dedicated course around this in CHS, and it might be a bit premature at this point, but at some point, Lindsay has the course that's starting right away, right? That's aimed more at undergrad students.
That's right,
Yeah.
yeah, so there's a course being offered this spring called Ecosystem Approaches to Health. It's open to upper level undergrads and graduate students, so please feel welcome to talk to me if you'd like to learn more. It's a transdisciplinary course with a climate justice orientation.
And one just other flag for those of you that do a lot of education, the CanMed's rules will be coming out, I think, quite imminently. And we've seen some edited versions, but neither of us are on the committee, but the people I talk to are happy about where Planetary Health has landed. It's taken longer than they had hoped, but it's going to be embedded, and I believe not an add-on.
Amazing. Well, thank you so much to both of you for being here, for talking about this incredible work, to the audience for attending, and everyone online. Thank you so much.
Thanks for the invitation.